Eastern Cape at one stage was particularly hard hit by COVID-19. Provincial authorities were accused of corruption and mismanagement of the pandemic. Now, the MEC for Health was fired at some point. However, how have things changed, if any, since the departure of Ntlemeza? We speak to sociologist and human rights activist Aphiwe Ntlemeza, who wrote a piece on the Daily Maverick highlighting some of these issues. And I'm also joined by the acting head of the health department in the Eastern Cape, Dr. Sibongile Zungu. She also joins us from the Eastern Cape. A very good afternoon to you both, and my thanks for making the time to talk to us as you talk to us from East London, both of you. Can I start with you, Ms. Ntlemeza, and your opening line in that hard-hitting piece that looked at the Eastern Cape and the COVID situation there? You say the following words, that nowhere has the failure of governance been more unambiguous than in the Eastern Cape, where corruption, mismanagement, indifference, and sheer incompetence have ensured that the province has been leading in COVID-19 infections. Why such a hard-hitting piece? Are you tired?
Definitely. And I think, Xoli, thank you for sharing that. And I think it's very important to just highlight specifically that it's not only my tiredness, but to the people of the Eastern Cape as well. But what is surprising and coming to the forefront is how people are not surprised as to the mismanagement and corruption in the Eastern Cape, right? And before, when it happened, even COVID-19, there was also skepticism that when it comes to the Eastern Cape, that it will be poorly dealt with. There were a lot of articles written by a lot of people, but regardless of the fact that the Eastern Cape had a lot of time, right, to organize themselves and to plan properly, still there's so much failure and deaths that were unnecessary, right? And even now, when it comes to the second wave, the Eastern Cape has been hit hard with deaths that could have prevented. And I promise you, Xoli, just in late last year, where we've seen a lot of regularities and also just super spreader events, where the government in itself, noting the second wave, noting how the first wave has went through, and still they're not trying anything to prevent that, right? Yeah. And so that also just goes to show as to how much more are they willing to even roll out the vaccine? How much more will people be protected? I mean, when we're talking about the same struggles of the Eastern Cape, it goes back to ages back, right? And when we're talking about the stalwarts that have been there, it doesn't translate to the development of the Eastern Cape. But even the national politics that are happening in the country are a reflection instead of the Eastern Cape, where politics takes more priority rather than the servicing of the actual citizens.
Dr. Zungu, let's bring you into the conversation. I'm going to ask you somewhat of a difficult question, because the minute you talk about a political head, it's almost taboo to do this for a head of department, where you shy away from expressing an opinion on the leadership of the political head. Talk to me about whether there has been any noticeable change in the Department of Health and how it's approached the COVID-19 situation since the departure of MEC Ntlemeza.
Thank you, Xoli, and good afternoon to Aphiwe and the viewers. Once more, I have to indicate that it was a fortunate situation for us that we actually tried to work on the COVID-19, and we went through the first wave. It was hard. As Aphiwe says, the words that she's putting forward are quite painful, given the efforts that the health workers put forward, given all the pulling together that the province did. Actually, the Eastern Cape, both the leadership of all the political parties in the province, in the municipalities, different government departments, pulled together to fight against COVID-19. With the first wave, there was a lot of effort, a lot of resources poured in. And when the second wave came, there were a lot of lessons from the first wave that were brought in. The ward-based rapid response teams worked with the municipalities at a local level, and also the bringing in of the law enforcement agencies in terms of your municipal the municipal police, and also the SAPS and the Department of Labor, everybody checking the retail outlets for compliance. All those efforts actually helped the Eastern Cape to stem the tide of COVID-19. Our health facilities were prepared during the first wave, and they were completed by the time the second wave came. So in terms of space in our healthcare facilities, there was space, there was equipment, there was oxygen, and during that whole time, the leadership of the province was there in both the COVID-19 Command Council and the extended COVID-19 Command Council that was sitting on a Friday, on a Sunday, and the district jogs in every district municipality and local municipalities, ensuring that the response is targeted, looking at which of those areas had the highest number of cases, and there was even monitoring of the areas where there would be outbreaks to contain those outbreaks immediately. So when you look at the second wave in the Eastern Cape, it came and it rose and it came down immediately. There wasn't a sustained stay of the spread of the infection because of the efforts that were put there. Yeah. And if you look at it, you would realize that indeed at all levels there was both political and administrative leadership, our clinicians, the nurses, the doctors, our community health workers, tracing all the people who were contacts. There was an effort that was targeted with all departments working together, both national, provincial, and local government.
Yeah. Let's come back to you, Aphiwe. And I'm going to ask you...
I'm sorry to interrupt.
Yes, ma'am. Go ahead.
I am sorry to interrupt you. I am just... While we're live and very national, I'm just very confused as to what were the national or local interventions that were done. So if there were interventions that were done, how was it that the Eastern Cape was leading when it comes to infections? How was it that super spreader events were also leading, right? How was it that the workers, frontline workers, were striking because they hadn't received PPE gears to also just protect themselves? I'm just worried because at the same time, I live in a residential area where students are mostly infiltrated, and where even the second wave started, where we know that it started and Forte and Wusu had to play a role in that effect, right? How is it then that the same area, there were never people coming into the same area to even do any, what do you call this? Sorry, she did mention that any for us to test or any regulations or whatnot, noting the area that we've lived in. So I don't want to just continue with lies at the same time, and also to perpetuate that the government has been doing a lot when we know that numerous and several deaths in the Eastern Cape have resulted in the mismanagement, the corruption as well, and also the poor planning of the same governmental sector.
Dr. Zungu, can I ask you to respond to the specific issue of healthcare workers who have been in the front line of this pandemic and them not receiving either proper PPE or sufficient PPE to not just protect themselves, but their loved ones as well, because this was an issue that even threatened at some point the healthcare workers in the Eastern Cape downing tools. How has the situation changed since then?
Right. Xoli, Aphiwe is relating to the incidents that came in the early phases of COVID-19. In our province in particular, indeed, because of the uncertainty and there was no one globally who knew about COVID-19. And the scare that came with it was such that we did not even have a good grasp of how to protect ourselves. And everybody wanted to rush in to wear the coveralls and all the PPE that we see people wearing on television and in all the pictures that are shown about COVID-19. However, when the Ministerial Advisory Committee was formed at a national level, they started giving us a guide on how to use the PPE, because it's not a cheap commodity, on how to then give categories of staff that should use certain categories of PPE. So those that were in high-risk areas were given a set of protective materials, and all the other people were given different types of protective materials. We started learning about these things as we were moving along and getting the advisories from the Ministerial Advisory Committee. And on top of that, we then had even the unions themselves coming in and putting forward their concerns about the safety of health workers, and there were discussions held even at a national level. There were then task teams formed, and the occupational health and safety committees were then formed from a national level with union representation, and they came down to the local level to address the issues of PPE. At a national level and with all the provinces, there was a stock visibility system that was then put in to ensure that each and every health facility and the province has visibility of the stock that is at the depot and the stock that is at the hospitals. And the ordering levels were marked such that when the levels come down, the stock can be replenished timeously. Towards the end of the first wave, we had already mastered that area around the PPE. And then the unions and the staff and management were guarding this closely because it was about the health of the healthcare workers. And the issues of infection, yes, you are mostly exposed at an institutional level, at a hospital level, when you are a health worker. However, we started realizing that there were infections that were not really happening in the workplace. The health workers were exposed during transportation on their way to work, and also when the infections arose in the community, the health workers were also not spared of community infections. So this was the challenge that we had, such that our health workers also got infected in all the areas just as much as the members of the public also got infected. Yeah. It is quite a sad situation for us, but it is something that was being taken care of in terms of providing personal protective equipment for our health workers.
Yeah. Aphiwe, let's come back to you. In your article, you actually take a focus on the ANC, where you say it actually is the problem, and of course, by extension, the government that it leads. And you use very strong language, and I just want to quote just a bit of what you say, and that is that the ANC in the Eastern Cape has been referred to as a criminal enterprise, masquerading as a political party, which has lost its cause for fighting for the dignity of black people. In the time that the new administration, as led by Oscar Mabuyane, has been in office, Aphiwe, Again, I'm going to ask the question that I asked of Dr. Zungu, that has there been any noticeable change, in particular the firing of Cindy Swakomba? Do you think that at least there is a glimmer of hope, or is it still much the same?
Honestly, Xoli, I'm very disappointed that we will also having this conversation where there's not an accountability of the lost lives, and also just in terms of how COVID-19 in the Eastern Cape has been handled, right? So the minister also talked, the MEC also talks about how they've taken priority in terms of PPEs, but I mean to tell you that this is something that is published throughout the newspapers, where there's been consistent protests where frontline workers were not willing to work because there wasn't any safety guided for them. But also, just what is more or less disappointing is that she mentions how as well money is an issue, but yet we talk about millions that have just gone by through corruption, right? And also just that they were learning as a phase as well as in the Eastern Cape. I mean, like, Xoli, you've also published it as Newzroom Afrika. We know this very quite well, where when the first breakout of COVID-19, the most skepticism came from how was the Eastern Cape going to handle this. So, and instead, the Eastern Cape had a lot of time to prepare for this, but also to close borders and prepare for quarantine places for people that were affected, but that didn't come to play. And so it's very disappointing that even on human rights, we will be discussing this and also talking about how they've played a role. But also that when it comes to your question, Xoli, it's honestly a question of the ANC nationally. And when it comes to the Eastern Cape, one thing that has come to play, and I mentioned in that article that, right, there's been stalwarts, like local and international stalwarts that have played a political role in our country and have progressed outside of the Eastern Cape, but that has never translated to the development of the Eastern Cape. And that shows you that it's not an issue. It's not an issue that is starting now, but instead the COVID-19 pandemic has exposed that of the Eastern Cape, right? And it shows you how within the Eastern Cape there's an issue on oversight. You can't be telling me that in the Eastern Cape that quarantine places, that an entire MEC of transport was implicated in that. Where was the premier in that, right? You can't be telling me that even in the health sector, there was those issues of corruption. And where was the premier in that? Giving the oversight, right? So there's an issue there. And it doesn't necessarily mean that because the premier, Umabiane, is there, it means that there's going to be a change in how currently the Eastern Cape has been run. And it's not necessarily a health issue alone. It is also an issue that reflects even how all institutions are run, and the state capture just basically stipulates that. So whether you're telling me of the education sector, where we always below within all provinces, whether or not we're talking about the higher education sector, where it is a reflection, and I mean for a specific the University of Forte, with a reflection of the politics that are happening and even in fact the gaps that are happening. It's an issue, right? So Mabuyane is not going to be the savior, because also we need to just dissect his role in this as well. But we also dissect as well what the others' role are, and accountability is an issue. But instead, what has been weaponized is the issue of violence and culture when it comes to accountability within the ANC. And this is my point. It just stipulates as well and shows to you the issue within the ANC itself, where moral decay is an issue. And unfortunately, in as much as I respect Umama Lona, but the problem is herself within the sector and after the previous MSC, there hasn't been any development.
All right.
There hasn't been.
All right. Just to make
so
it
what
clear.
is she doing and what is she coming with?
All right.
Because infections have risen. Also, there's an accountability of the fact that the same Eastern Cape when it comes to numbers of the infections, we have been miscalculating. That shows you that our data is wrong.
All right. Let me interrupt you there, Aphiwe, and I want to bring in Dr. Zungu very quickly. Dr. Zungu, first, let's respond to the allegation that Aphiwe makes, even in the article, where a guest house owned by a politician's daughter, this is the allegation that she makes. This is the daughter of the MEC of Transport, Weziwe Tina Qotiwe. Was it ever used as an isolation facility, and where monies dispersed as such?
Totally on that particular matter, I might not be aware of it. I wouldn't be aware of which facility was used for what, when, and who owns it. But I'm aware that the province had sufficient quarantine facilities at the time when we had the wave, the first wave and the second wave of COVID-19.
Yeah.
And at this point, the province has the lowest number in the country in terms of the active cases of COVID-19.
Yeah.
And the province has ridden the first wave and come to a point where the numbers were low, and that is why we could see when the numbers were increasing and had the second wave, the province was the first one to come out of the second wave and has stayed out of the second wave throughout from the end of December up to now. The province is still out of resurgence and has the lowest numbers of active cases, and is closely monitoring the two metros where we have a concern because of non-compliance of individuals, non-compliance with the COVID-19 regulations and the safety practices of social distancing, wearing your mask, washing your hands, and ensuring that you remain at home unless you need to be out.
If you're just joining us, well, we are in conversation with the sociologist and human rights activist Aphiwe Ntlemeza, who wrote a very stinging piece on the Daily Maverick highlighting some of the issues around COVID-19 in the province of the Eastern Cape. Who also joined in the conversation by the acting head of the Department of Health, and that's in the Eastern Cape province, Dr. Sibongile Zungu. Dr. Zungu, I was in the middle of giving you the right of reply after the accusations that have been made by Aphiwe, in particular against the health department, which you are the head of department of. I want to conclude by asking you whether you think there is political leadership to avoid a third wave that could be as deadly as we saw the second wave being. Can the third wave be avoidable, and is there political leadership that is capable in fighting this off?
Totally, the third wave is avoidable if we adhere to the non-pharmaceutical interventions and ensure that each and every individual takes responsibility to keep themselves safe. And my prayer is that we receive sufficient doses of the vaccine, that most people should be vaccinated by the time we have high numbers and we get into the third wave. And also, my prayer is that when we get the vaccine, we should be able to get people coming forward, because we can have the vaccine, we can have the trained nurses to vaccinate, but when people are not coming forward, it does become a bit of a challenge. And lastly, on your question, the Eastern Cape has always had the strong political leadership to fight COVID-19, right from the first wave to the second wave. And even when the third wave comes, we have leadership at all levels, from local municipalities to district municipalities to the province. We have had leadership. Joint efforts have been pulled together, with others even providing resources to assist the Department of Health with tracing, with various resources to ensure we work together. Actually, there are a lot of good practices that have come out of the Eastern Cape that are being emulated by other provinces. For instance, for the writing of the matric exams, the Department of Health joined the Department of Education to assist with the writing of matric exams. When it came to marking, the Department of Health again ensured that each and every marker that presents at the marking station in the Eastern Cape is tested for COVID-19, and that protected the markers, and those that were found positive were actually recused from marking, and new were brought in who were also tested as they came in. And as such, the infections in the marking centers in the Eastern Cape or deaths in the marking centers were averted. So there's a lot of partnership that is coming forward. And at this point, the Department of Health is working with all the departments, the municipalities, to ensure that it reaches out for vaccination of the frontline workers as soon as the vaccines arrive. But the preparatory work has already started to work with other departments to start identifying people that are of advanced age, to ensure that people receive the vaccines early to avert a negative outcome should they get infected with COVID-19.
Ms. Ntlemeza, you get to have the last word. Are you convinced of a strong leadership that will help in trying to avert a deadly third wave?
Unfortunately, Xoli, we don't need prayers right now. We've passed that stage. We need implementation, we need accountability, and we need action. And her saying that, her prayers, that for me is basically ridiculous, but also tells us how, in fact, the Eastern Cape is not ready to also just officially, just effectively roll out the vaccine strategy. I mean, we don't even have a strategy to even place and tell us how people will be vaccinated from even the rural areas. I mean, there's a billion or a million there was in the scooters that were ridiculous. In fact, dehumanizing black people more than anything, and that was not a success. So how much more then should be convinced that all will work out in the name of prayer? And it's ridiculous to point out as well, just because of the education sector, when a lot of people have died within the same sector of things that could have been prevented. What people need now is actioning. They need, even in terms of what is the action and the plan of the Eastern Cape, and not just convincing and lip service that keeps on happening and happening. That's why you get even like the intervention from different provinces, because we know the Eastern Cape is not capable. And my only concern is that this year, there was a video surfacing of a Buccaneers event, a super spreader event, where people were not wearing masks. And NGOs had to play a role in making sure that people were accountable, but the government was keeping quiet. That shows you the level of just accountability, but also actioning from the province. We need actioning. People have died at the expense of the same ANC government. These lip service are not working for us.
All right. That's Aphiwe Ntlemeza. She is a sociologist and a human rights activist. Thank you for your time. We also thank Dr. Sibongile Zungu. She is the head of the Department of Health in the Eastern Cape Province. Thank you for your time. It is